Is it a spike or a trend? Tonight, health officials wonder how to interpret rising numbers of local youth infected with a potentially deadly disease. Larry Seward explains.
Cynthia, 5 years ago, Kansas City's Free Health Clinic treated 5 or 6 patients in their youth HIV case management program. It's now up to 48, but there is room and need for many more.
It's also very appropriate for that age group to be making those decisions.
Amber Rossman enjoys showing off Kansas City's Free Health Clinic. More than free meds or treatment, this place fills needs.
I saw outcomes quickly.
For Rossman, it began 15 years ago when she first met teens infected with HIV and fear.
Each time I met with somebody and they understood what their risks are and they understood if they were positive they could get into care, I felt success.
The health department doesn't. Not yet. Not with rising numbers of HIV infections in one group this year and last. Men ages 24 down to boys as young as 13 account for a third of all new HIV infections in 11 counties in and around Kansas City.
We're seeing a lot of young people that have the attitude, especially since the treatments have been so effective, that either it's not that big of a concern.
Perhaps more troubling, health officials say rising numbers of infected teens are using cell phones and websites like Facebook to set up anonymous sexual encounters.
People's inhibitions are probably lower when they meet people. They're feeling like they know them better, so they may not be asking about their HIV status, asking when they've had an HIV test or an STD screening. So, you know, with that familiarity with people aren't asking those questions.
Rossman's clinic asks using Twitter, Facebook, and CDC's online testing resource site. The very technology driving up infection rates is being used to lower them. The question now, how long until those needs are filled?
At this point, case managers simply don't know how long reversing this trend will take. But a few years ago, health officials here in Kansas City saw a similar infection rise in men over 45. After an information blitz, they say numbers fell. So using the same formula, via new technology, they hope it nets similar results in teens and young men. Larry Seward, NBC Action News.